Good morning, my name is Dr. Chandelique and I am coming in from Flint, Michigan to have a touch up on my eyebrows. I had an eyebrow transplant about 2 years ago, so I'm back to get a touch up.
We're doing today a touch-up for an eyebrow transplantation that we had initially performed on her. And as you know, usually we need to do touch-ups to make it to the final results. So the important aspects in this part right now is to have a good design to work with. As I mentioned in her initial transplantation, we had already created a very nice shape to her brows. And now we're gonna fill in some of the gaps with real hairs. The important three aspects on the design of an eyebrow, which is where I'm mostly involved, is actually that it starts right in the medial aspect, that it peaks at the right spot, which is usually in the junction of the second and third aspect here of the brow, and that it has good thickness and good length. So we already have a good base on her. You can see we have more hairs than we had the initial time, and we're going to fill in some of those gaps with this touch-up procedure.
Usually when patients come for a touch-up, they leave the hairs very long, and what we do before starting the procedure, we actually trim them and guide them how they can reshape them for the next 2 to 3 weeks, because after the transplant, they cannot do what they used to be doing, the lamination or the products that they used before. So what we did now is we trimmed her brows, and then we put a little bit of Aquaphor and kind of guide her what she could do for the next 3 weeks.
Alright, so we're all done with our procedure. How did it go? How did
It
you
went,
feel?
it went well. I feel great.
Awesome. So we just finished implanting about 350 grafts we harvested from the back into the eyebrows. This is our second procedure, a touch-up. Like we usually mention, some patients need a touch-up to increase the density. And the first procedure, we were able to recreate the shape that she was looking for. And the second procedure, we increased the density. So you can see just the grafts have been placed in the eyebrow area. And now she's just a matter of time to recover. We expect some swelling. Pain is usually not a big problem, but swelling in the periorbital area, it might be part of the healing process, and in about 3 to 4 months, those new hairs will start to grow.